my most recent melanoma, I went in for my, essentially every 90-day check. And I had thought I had felt a spot somewhere completely outside of the range of where my other melanomas were. So I had kind of gone in with a little bit of like high intensity, like, okay, this is where I feel like there might be an issue. And immediately they kind of looked at that spot and they're like, oh no, that spot's good. But it's actually right outside of the area where they did the complete removal. It's right outside of it. There was like one little tiny spot. Right now it's stage 1, so it's fine. I'm going to get my surgery on September 4th, but it was definitely one of those moments where I was reminded how important it is to get your checks, because what we think as patients and as what we think may be a problem could be so completely wrong. The spot that I thought they were like, no, no, never looked better. And then as they went through my body, and that's why you need professionals, they were like, actually, this spot is a little bit of a problem. Can we biopsy it? And then we kind of went from there.
This is such a key moment. I want everyone to hear this and really digest this and understand this. You have to be an advocate for your own health care. You know your body better than anybody else, even better than the dermatologist. If you're worried about a spot, you feel like something's been changing, you feel a tingle, something's just off. If you're a mom, I call it mother's intuition. If
Yeah.
you feel something like that, then absolutely be persistent and don't be afraid to tell your dermatologist, hey, look, I really want you to take a look at this spot. Or if you need to, get a second opinion. This is probably one of the most important things that anyone can hear today.
And I think the thing is, like, even though I wasn't 100% accurate on where that spot was, I felt something wasn't 100%. And so I knew kind of going into the check, like, okay, I really need you guys to be diligent right now because something doesn't feel 100% right. And I think so oftentimes we're told to mask that feeling because we want to be positive or we want to be excited, like we want to believe that we're in the best place possible. But the best place possible is making sure that we're getting treatment.
I'll get patients that come in and they'll get the checkbox. Yep, clean bill of health. We didn't find anything. Well, that's just at that moment. A week from now, a month from now, 4 months from now, or any period of time, something could change. And
Yeah.
again, I don't want you a month from now being like, well, I've had that spot checked. It's probably fine. No, maybe you've noticed it's changing. You're worried about it. Then you need to either go back or get it looked at again by somebody else. Absolutely. Don't be afraid to be an advocate for yourself. The first sign of melanoma is very difficult. It's if there was one, then we would all know it and we would diagnose all of them, but as in situ. But it's difficult. But don't forget about the ABCDs. You're looking for moles that are asymmetrical, an irregular border, more than one color, a diameter greater than 6 millimeters, and then E, the evolving, the one that's changing, like I told you. But what's really scary is that there are some that don't even have that pigment. So it really takes a once a year skin check with your dermatologist is what's best. And then being a strong advocate for yourself and making sure you know your skin as well. And if something's changing, something's different, come on in. We have a lot of other technology that we can use to help identify concerning lesions and whether or not you need a biopsy. Question about how often does a low risk stage 1 melanoma progress into a stage 4? The answer is too often. Unfortunately, most of the deaths in melanoma are originally diagnosed as stage 1 or stage 2, which are early stage and are supposed to have very high cure rates. Now, again, this is a little bit of a game of numbers. There's just a lot more patients that are diagnosed with stage 1 or stage 2. So even a small percentage of a large number suddenly becomes quite impactful. The point is that all of these melanomas have the potential to advance, to grow.
A lot of people say, like, what are you most nervous about when it comes to going to the doctor? For me, it's that phone call. It's that phone call afterwards. So, something that I've expressed to my doctors is like, I'm actually okay with a text message. I know it sounds really silly, but like seeing a phone call and having to answer and having to have the right thing to respond, like sometimes I'm not ready. So, I think it's really important to communicate with your physician how you best like to like receive information. I've told both my doctors, guys, when you get the results, please text me. And then when I'm ready, I will call you and ask the questions, but I want to actually be able to take them in. And so, like, they will text me and say, "Hey, we got your results back. It's not the news we necessarily wanted. When you're ready to discuss the actual results, call us." And I think that has given me a lot of peace throughout all of this, not feeling like I have to answer that call at that second and be 100% ready for the information, but no, they can respect the way that I need to take in that information.
I love hearing that so much, Teddy. That tells me you're going to see some really good doctors because they're giving you more control.
Yeah.
Usually, when you go to the hospital or you see a doctor, you're out of control. Who even
Yeah.
knows what's going to happen? You're in a gown and it's probably doesn't feel good. You feel half naked. And then what procedures, what biopsies, what's going to happen next? And then who knows when you're going to get a result? There's no control over it for the patient. And at least now your doctors are giving you some control back. So I love hearing that.
Yeah, and I think that's, something that Castle Sciences does as well, is it gives us the ability for something that's so out of control, like melanoma or skin cancer, all of it, it gives us the ability to have that information. And I think that has been so pivotal to me is being able to feel like I can be an advocate for myself. Like it's one thing to be an advocate for your kids or your business or your life, but sometimes there's this feeling when it comes to you that you feel like, am I okay to do this for myself? And I think, with my doctors and with Castle Sciences, the fact that I am able to hold a little bit of the cards and feel like I know what's coming next has been huge. And I think that for anybody that's struggling with what I'm struggling with, or anybody that's unsure if they have melanoma or if they have skin cancer or whatever it may be, having that ability to have resources is so huge. When you feel like it's so out of reach for you, that's where you don't get checked. That's where you don't figure out the next steps. So I'm really grateful for that.
Castle, they provide more information and they're testing the DecisionDx-Melanoma. It provides a wealth of information that can actually guide your care. The most impactful study is the one where we surveyed and asked patients, what do they think of this data? Is it important to you? Is it important to how you feel? And literally more than 90% of all the patients who have had their Castle testing done, the DecisionDx-Melanoma, they're so grateful. They're so happy, even if it's just simply reassurance, because this isn't acne. This is life or death melanoma.
Yeah, and I think there is so many things in the world today where we're able to turn a blind eye to certain things in our health and what's going on inside of our bodies, but this is one of those things where you cannot. And if you feel like you're limited from the information that you're getting, it really puts you at a disservice. So the fact that I'm able to be given full information and go forward that way has given me a lot of peace. Even though, yeah, right now at this moment, I'm in like a hard place. You keep thinking that you're going to be done and then you're not done. And it's the highs and lows and all of those things. But at least knowing that I have the accessibility to find out more information gives me peace.
So one of the questions we often get is, how does the DecisionDx melanoma test work? Well, it's a gene expression profile. So it actually looks at the genes of the cancer. First question is, oh, do you have to do additional biopsies or testing or anything like that? And the answer, thankfully, is no. They actually take the original biopsy of your melanoma, that gets sent off to the company. They macro dissect that out, and then they actually look at the genes in your specific cancer. And the result is generally a high risk or low risk. It actually even divides it up even further than that. So it's low risk, middle risk, and high risk. And then it also, we can take your specific characteristics about you and your cancer and give you your specific risk for your specific melanoma. This is personalized medicine at its best, and it provides information that can tell you whether or not you really need to go through a sentinel lymph node biopsy procedure, whether or not that melanoma is going to come back. And that helps drive how we treat our patients. If you're at a high risk of this cancer coming back, guess what? We're going to do high risk surveillance. We're going to image you. We're going to see you more often. There's lots of things that we can do. Now, if you're low risk, then that's quite reassuring, and we can actually de-escalate our care. We don't have to do all this other invasive testing or procedures. So really, again, the test looks at the genes, can tell you whether you're high or low risk, your specific personalized risk scores, and from there, your clinical team can best manage your cancer. So what's the difference between genetic testing and GEP testing? Well, genetic testing is where you're taking your normal cells and you're looking at the genes within those. And you're looking for mutations. The most common one that you've ever probably heard of is the BRCA. This one, when you have a mutation, it's been associated with breast cancer and several other cancers. Now, with gene expression profiling, you're actually looking at the genes within the cancer. And you're looking for a specific pattern amongst these genes that can tell you whether or not you're at high risk of this disease progressing or metastasizing, or if you're at low risk. I often get the question of who should be getting the DecisionDx-Melanoma test, and hey, wait, I've had a melanoma in the past, can I order it now? The answer is if you have an invasive melanoma. Now, remember, there's different types of growth phases when it comes to melanoma. They'll start growing side to side, and that's when they're just called in situ. Those, you can't order this test, nor will the test be run on those lesions, because again, they have such a high cure rate. It's not going to change your management. Now, the moment that melanoma turns down and starts going down into your skin, it's called an invasive melanoma. You got about 100,000 of the in situ and about 100,000 of the invasive melanoma diagnosed every year. Those are the ones that, yes, this test qualifies to be ordered. The other question about, hey, look, I've already been diagnosed with melanoma a year ago and I didn't get this test. You know, my doctor didn't order it, but now I know and I want it. The answer is yes, you can have this test ordered. Now, if it's already been a couple of years, you might have to have your doctor have a discussion to understand exactly what may change in your management. But if you've had the melanoma, I'd say in the last 2 years, it's worth having a discussion with your dermatologist about ordering the DecisionDx-Melanoma test. When it comes to access for any of the Castle Biosciences tests, whether it be for melanoma, squamous cell, or for their GI cancer as well, what's really amazing is that they provide 100% access for this test. Medicare, CMS covers the DecisionDx-Melanoma test, so I'm never worried about it for those patients. And then when it comes to any and all the other patients, they have this incredible patient assistance program.
I think there's nothing more frustrating than, like, you know, for me, who I'm not a physician, I'm not a dermatologist, I don't have all the information. You know, I have the World Wide Web, which can be very scary. I start Googling or I WebMD and I create all these new situations. But when you're actually given the data and the information, then you can go from like a logical place of like, what is the next step for my health? And then also know that you have physicians and doctors that are going to do the right thing for you, but at least you can go in knowing, okay, this actually sits well with me. This makes sense to what my diagnosis is, or I've been given this information and I can give it to my family, or I can choose how much I want to share with those people in my life. And I think when you don't know is where the most anxiety comes in. and it can be the most harmful. So I'm just beyond grateful for not just the access, but the with ease of being able to know I can be given this information and then I can do what I want with it and I can be an advocate for myself. I don't have to wait for somebody else to take action for me.
Can a patient order the DecisionDx-Melanoma test? No. It actually requires a clinician to be able to order this test. The reason why patients can't just simply order this test is because it provides a lot of very important information that you need to integrate within the whole clinical picture that is going on with you. It's not something that is easily understood. You actually need to understand what your melanoma is, what your history is, and what sort of decision-making process you need to go through to find the right treatment for you, which is why, again, a clinician needs to order the test. Now, let's say you're interested in it and you really want this test ordered, is click the link and you'll be able to get linked to a number of different clinical providers, dermatologists that are familiar and comfortable and experts with GEP testing, and they can go over your specific situation or go see the dermatologist that you've been seeing for the past several years. We all want to see you, and you can get all the help you need for your concerns there.
I've had a lot of people reach out to me about my immunotherapy treatment. And originally going into it, I thought that was going to be more the easier route. I didn't understand the hardship it would take on my body. I was like, "Oh, this is a cream. Like, a cream is not gonna affect me, like, I'm not gonna feel any different." And I immediately felt my immune system take a shift. I felt more exhausted. I felt my body like there was a tingling, there was a pain, and there all of it. Parts of it worked wonderful for me, and parts of it were actually a big mind game. Like, it was a big I don't even know how to say it. Like I thought it was going to be the cure all. I think with everything that you can't control, you hope you're going to be able to put your finger on it and go, okay, now we're done. Great. And now here I put this on and I'm going to do this for 6 weeks. And that really wasn't how it was. Each week was kind of a new lesson of what this cream was going to do to my body and how my body was going to react to it. And I'm not going to sugarcoat it. It was really hard. And there were parts of feeling nauseous, there were parts of feeling whatever, but it with everything, it affects all of us differently. So I never want to give anybody fear of not taking action and doing whatever feels best for them. Something that really kind of drove me crazy during, my most intense versions of melanoma was when people would tell me that I should do something other than what myself and my doctors had decided would be best for me. I've already come to this decision. This is what gives me peace. This is what gives me and now, "No, we think you should do this." Like, this is where I've come and this is, but I've been very transparent about it. It hasn't always been easy. Did I think immunotherapy was an easy route for me? No, I have very sensitive skin. I've always been very sensitive to medication, and it was difficult. Ultimately, it didn't work for me. So, I think that's something that also comes into effect, but you have to decide your own course of treatment and what's going to work best for you and your lifestyle. And at that point in time, I really thought with my kids, my active lifestyle, that was going to be the best option for me.
That is the right treatment. That is because it was the right treatment for you at that
That
moment.
time, right. And ultimately, it prepared me for a very big surgery that I don't know that I would have prepared for with the minor surgeries I had had prior. Like, all of a sudden, I was like, "Oh my gosh, this actually is a really big deal because I can feel this throughout my whole entire body." Like, everything is shifting, and so, ultimately, throughout finding out what works for our bodies and what doesn't, you're going to have trial and error, but information is key.
Our job as physicians is to walk our patients through this journey, being able
Yeah.
to predict what's going to happen, know what's going to happen next, and hold your hand and step through it together. So those topical immunotherapies, it was probably topical imiquimod. Yeah, if
Yeah.
you put it on a large surface area, you get flu-like symptoms. And it's easy for me to say flu-like symptoms, but you just described it the best of all. I mean, it hit you like a truck, is what
Yeah,
you
I was
described.
like, "What?" I
Yeah,
really thought it was something else. I was like, "There's no way," because it comes in this little tiny
little packets.
container and you're like, "This," and then they're like, "Open 4 of them because of the location." And the first week you're like, "What? I this ain't no big thing." And then by the end you're like, "Hold on. What happened to me? Who am I? Why do I
Yeah.
feel this way?" And I think that is really melanoma, skin cancer, anything in a nutshell is like we can't control how our body reacts to any of it. Originally, when I started down this process and I was diagnosed with melanoma, nobody offered this test to me. And it's one of my biggest regrets because now that I have done so much research on this testing, uh, it's something that would have eliminated so much fear or anxiety or worry. So it's one of those things moving forward that I 1,000,000% would do, but it was something I was not aware of when I originally went on this journey. And which it's so why it's so important to me to talk about right now because I didn't know this testing existed. And had I known, maybe I would be in a different place than I was now. A big question that I get, which also has been a big critique that I have gotten on social media, which was, we saw you years back, you were running in your sports bra or you were doing this outside at the beach with your kids. Would I go back and change time? I mean, I can't. I had so many amazing memories and I did so many great things. But now knowing what I do know, yes, of course, I would have changed the way that I was dressed. I would have changed the way that I used my SPF. I would have changed so many different things because I was so not aware of the repercussions of melanoma. There are moments, yeah, there are going to be moments where you're bummed, where you're going to Mexico with your friends or your family or your whatever, and everybody's out and they're doing whatever it is that I did for so many years. But now I'm like, no, I've found skin protection, swimsuits, and I'm always covered by, um, I always have an umbrella. I always make sure the following things. I'm always reapplying my sunscreen every 45 minutes. And those are things I never did because I never thought it was a big deal. More so than how I've treated my body and myself, it's how I can train my kids on how important it is to treat their skin. Because when I was their age, I was applying baby oil and iodine and doing everything I could to get as tan as possible. And now I'm like, there are so many different ways. Like, I get it. If you must, like, you can put on a self tanner if you wanna, change the aesthetic of how your skin is looking, but ultimately, that some of the tanning bed and the being out in the sun and doing all of those things as a kid could have been the reason why I am where I am today. And yeah, there's a guilt proponent to that because why as a 14-year-old did I not think through that? It's more about where we are in the world today and how much more knowledge we have. And now that we have this knowledge, how do we bring that forward and share it with others? Like not only is there testing, there's also appropriate sunwear, there's appropriate skincare, there is ways to protect yourself that we never thought about.
So awesome to hear this because I have a 4-year-old daughter and I know she's not going to look up to me my whole life. Got millions of people that are looking up to you, a lot of young women too. And you giving that message out there in such a confident way is going to have an impact. So thank you.
Thank you. No, it's really been something that I overlooked for so much time. And I think that's why I'm so passionate about this right now is because I mean, I always thought like skin cancer or melanoma is a different type. Like it's not as big of a deal. And that's just not the case. And so if we don't protect ourselves, as important it is to get your mammograms or your colonoscopies or whatever it may be, or even just your physicals, but you have to get your skin checked. And I overlooked that for a lot of years, and it's one of those things where, like, I will never overlook that for my kids, and I will never overlook that for myself again because I realize the impact that it can have on you.
We've talked about primary prevention with sunscreen, seeking shade, but the secondary of, hey, skin checks. It's so easy. You brush your teeth, you work out, go get your skin checked, all right? At least on your birthday month, go get your birthday suit examined. That's what I tell all my patients.
Yeah.
So,
And it's easy, guys. You really just go in and find a place that you're comfortable and just get it done. That is the easiest part. The part that I was the most worried about was actually the easiest part. Go get your skin checked. Any questions that you have or any concerns, like me and Dr. Farber, we are 100% here to answer them. And the thing that I love so much about working with Castle Sciences is that I know that I have a team of people that want what's best for me, but want what's best for everybody. So I think that's what is exciting about working with a company like this. It feels very hands-on and not surface. So I'm very, very grateful to you guys.